Hello everyone. We saw what is a herb, how do we identify this herb, how does this herb occur in the market commercially when it is prepared for the market, and when we identify a herb, we identify whether the herb is in its natural form unadulterated. It should not be mixed with anything else other than its official form, which is mentioned in official texts and pharmacopoeias. What is this world of adulteration which is causing so much concern in the area of herbals? So, I am going to introduce to you what is adulteration, what are the reasons for adulteration, why is adulteration on the rise, what are different kinds of adulteration, how do we classify this adulteration, and more importantly, how do we identify this harmful adulteration. It does not mean that adulteration is useful, but sometimes it remains inert, but the harmful adulteration is causing concern. Adulteration of crude drugs means mixing a genuine natural drug with inferior, substandard or harmful substances, often used to increase profit. What does a genuine natural drug means? A genuine natural drug is a herb or a part of the herb. So, it can be any part of the plant which is known to contain that active constituent responsible for therapeutic activity. So, anything else present with this drug, we term it as an adulterant. So, we either term it as an harmless adulterant or an adulterant which is of deep concern. So, anything which is mentioned in an pharmacopoeia or official text known to be an official drug is a pure genuine drug. Anything other than that may be from the same plant. Like for example, suppose in case of Vasaka, the leaf is considered to be an original drug. Along with the leaf, if there are some branches, part of the stems, part of the bark found mixed with that, the other parts are called as adulterants. So, this adulteration is done mainly for economic gain, but detecting adulteration is crucial to ensure safety, efficacy and the trust in herbal medicine. Since the herbal medicines or herbal market is little loosely regulated as compared to the other synthetic drugs, it is very important that we detect the adulteration, and detection of adulteration and the absence of harmful adulteration is strictly governed by pharmacovigilance, and it is very important that we detect this adulteration before putting the formulation or the herb in the market. Why are these crude drugs adulterated? Adulteration can occur due to economic, environmental, technical or regulatory factors. The reason can be broadly classified as we are going to discuss now. The first one is economical motivation. This is an intentional adulteration. Profit driven substitution falls under this economic motivation, replacing costly drugs with cheaper alternatives. So, suppose there is a big demand for a drug which is very expensive, like for example saffron. Because saffron grows in a particular geographical area, it is not possible for everybody to grow, and because there is a big demand of saffron in the cosmetic industry or in many nutraceutical and wellness products, this drug is often adulterated with saffron is a stigma of a flower. So, this is often adulterated with any colored threads or some other flower stigma. For example, cardamom seeds, when they are sold loose, cardamom is also an expensive drug. When the seeds are sold loose in the market, that is also very commonly adulterated. So this is a profit driven substitution. Addition of exhausted material. Used plant material is mixed with fresh ones to increase the bulk. A best example here to quote is these umbelliferous fruits: fennel, coriander, caraway, ajwain, cumin. When you remove the volatile oil, the morphological features of these fruits remain a little unchanged. So, mixing these with the fresh drug is a kind of adulteration, where we say that, or storing the material for a longer period of time where the volatile oil evaporates, and thus this leads to exhausted material. Mixing this with a freshly collected drug is called addition of exhausted material. Use of synthetic chemicals. Artificial dyes or chemicals are added to mimic natural color or activity. Turmeric is the best example, where we have come across literature which says that turmeric was adulterated with synthetic dye which was found to be carcinogenic. Hence, it is very important to study the adulteration occurring in these crude drugs. Lack of proper identification. So, the botanical misidentification, when morphological features remain same and drugs are commonly known by their common names, there similar looking drugs may cause adulteration. Regional vernacular confusion. Rasna, there are 10 types of rasnas available in the market. 2 types of sennas we know which are available. So, regional vernacular names also cause confusion at times. Lack of standardization, improper harvesting, collection at wrong season or wrong stage of growth reduces the potency of the drug. So, the drug may look the same, but when it is collected in different times, there may be lack of active constituents present in the drug. Improper drying or storage, when you collect the drug fresh and store it without proper drying, this leads to microbial contamination. So, many a times what happens is the microbial growth is killed by heating the drug or drying it in sun, but whatever the microbial toxins are there, they still remain in the drug. This is improper drying or storage and adulteration caused by those microorganisms, fungal growth, or by degradation of the drug. So, whenever there is fungal growth, the fungus is killed by heating or drying of the drug, but those fungal aflatoxins penetrate the drug and they remain there present with the active constituent. So, when we make extracts of such drugs, those toxins are transferred to the extract. So, that is a major cause of concern. Unintentional adulteration because of environmental contamination, like heavy metals, pesticides or microbial toxins may contaminate the drug. Many times if some water contains some heavy metals which is not visible during cultivation of the medicinal plants, if such water has been used which is heavy in pesticides or microbial load, this may contaminate a drug. Here there is no intention of adulterating, but this adulteration comes from an unknown cause. Mixing during processing. Suppose the crude drug is processed for pulverizing or for drying it in a tray dryer, then previously used drug may contaminate the current batch. This is cross contamination in shared equipment or in storage facilities. Same boxes, same bags, if they are used for different powders, this can lead to mixed contamination. During the supply chain, if a crude drug is being transferred and if the drug is susceptible to higher temperature, lack of stringent quality controls, especially in the unorganized drug market or the traditional supply chain, may lead to adulteration of impure or inferior quality drug. Demand supply mismatch: whenever the supply and demand does not match and the logistics change, there is a scarcity of genuine material that leads to substitution or dilution. Hence, there is a need to detect whether the genuine drug is present or it is adulterated with other this thing, and the regulatory limits mention in case of each drug of how much percentage is allowed, whether it is detected by physicochemical or by other methods, and the amount of adulteration present. So, in such cases, by looking at the amount of adulteration, a herb batch may be accepted or rejected. Detecting adulteration is vital for public health, scientific integrity and regulatory compliance. It ensures therapeutic efficacy because only genuine drugs deliver the intended pharmacological or therapeutic effect or use. It prevents toxicity, which is more important than the therapeutic effect. Adulterants may be toxic, allergenic or carcinogenic. It maintains a consumer trust. So, for a company to stay in the market for a long period of time, it is very important to develop a customer trust and relationship. So, all the herbal companies which have stood the test of time and who are there, especially in the Indian market, have won the consumer trust by delivering adulterant free formulations. Quality assurance builds confidence in herbal and traditional medicines. Supports regulatory compliance, which is required for pharmacopoeial standards, the WHO good manufacturing practices. Ayush has laid down guidelines to see to it that any company is putting a formulation in the market should be free from any kind of adulteration or toxic contaminants present, and especially when we are planning an export of the herbal raw material or a finished formulation, it should meet the regulatory compliance and certifications. Detection of adulterant also protects biodiversity. It prevents over harvesting of endangered species and promotes sustainable resourcing. There are different conditions which are identified when we find something else mixed with a genuine drug. This is deterioration, admixtures, sophistication, substitution, inferiority and spoilage. So, deterioration, the kind of adulteration which happens because of deterioration of the official drug, is impairment in the quality of the drug. For example, Feniculum vulgare, which is fennel, Syzygium aromaticum is clove and Coriandrum sativum, which is coriander. All these three are known to contain volatile oil. So, upon a long storage, if the volatile oil evaporates from these drugs, then there is a deterioration in the quality. Syzygium aromaticum, while processing and collecting, if the clove flower bud is allowed to open, then also the volatile oil is lost. So, when these drugs are stored for a long period of time at high temperatures in the storehouse, warehouse or during the supply chain, if the temperature goes little high, then the volatile oil is lost and these drugs may not have the required therapeutic effect. Admixture is when there is addition of one article to the other due to ignorance or carelessness or by accident or intentional to increase profit or make it more economical. This kind of adulteration is called the admixture adulteration, where we find that turmeric powder most of the times, because of the high demand and the cost, is mixed with a synthetic dye, and this synthetic dye is raising alarms as it can be carcinogenic. Or argemone seeds are adulterated with less expensive mustard seeds. Sophistication is the word sophistication because this kind of adulteration is done in a sophisticated way where it is difficult to identify the adulteration macroscopically. This is an intentional or deliberate adulteration where the official drug is substituted or mixed with something which where the morphological feature is same. For example, ginger most of the times is mixed with other drug powder, or with sawdust it may be mixed, something less cheaper and similar looking. Substitution, where a totally different substance is added in place of the original drug. So, saffron, which is priced very heavily, saffron if you see in the market, there are some people who sell saffron at 100 rupees a gram, whereas others sell it as 1000 rupees a gram. So, here which is adulterated, which is pure, it is very important to detect the kind of adulteration. So, the cheaper quality may have the stamens from some other flower, it may have some other kind of foreign organic matter which is mixed with saffron and sold. Piper nigrum, these fruits are mixed with papaya seeds. So, if you see here the morphology looks the same, but this is devoid of piperin. There is no piperin present in this, but morphologically they look the same. Here also if you see the Carthamus tinctorius flower is used instead of Crocus sativus for saffron. Inferior quality mixing or adulteration refers to mixing of an official drug with a substandard drug. For example, Strychnus nux vomica is mixed with Strychnus patoterum. This is a substandard drug and does not have strychnine and brucin as mentioned in an official drug. Indian senna is adulterated with Arabian senna. So, if you see here the morphology looks the same, both belong to cassia genus, the leaves, the flowers are same, but the anthraquinone glycoside content is different. Gingiber officinalis with Japanese ginger, Solanum species with other Solanum mammosamum instead of Xanthocarpus species. So, the atropine content, the alkaloidal content is different in both the drugs. This is mixing with substandard quality drugs. Spoilage, when the drug is stored, not properly dried, not properly harvested, collected, and leads to deterioration of drug because of moisture content and microbial growth, the spoiled drug is mixed with official drug and powdered and extracted. For example, Vacha, you can see here the spoiled drug looks more shrinked or wrinkled, and another example is Athivistum with spoiled one because of the microbial attack. So, adulteration may be intentional or it may be unintentional, arising from different reasons which we just saw. Substitution is the major kind of adulteration which is seen in commercial herbal drugs which appear in the market. These drugs which are found in natural form are adulterated by substituted or substandard varieties, may be of inferior quality or artificially manufactured commodities. Substitution with substandard, one example we have already discussed, the other one Indian senna with Arabian senna, and yet another example is gentian, which is an expensive drug substituted by kutuki. Substitution with superficially similar drug. So, we saw one which was Piper nigrum with papaya leaves. Nutmeg seeds are mixed with mud balls made in similar shape of nutmeg. Nutmeg is also an expensive drug, and it is seen that it is mixed with these earth or mud balls made in similar way. These inferior drugs used may or may not have any chemical or therapeutic value as that of the original drug. Due to their morphological resemblance to the authentic drug, they are marketed as adulterants. Belladonna leaves with ailanthus leaves is an example of such superficially similar but inferior quality drugs. Substitution with artificially manufactured substance, or again similar looking substance, compressed chicory in place of coffee, or paraffin wax substituted for beeswax, where the original official drug is very expensive. Of course, these days the flavor of chicory is liked and coffee is mixed with chicory for that blended flavor, but the constituents of coffee and chicory are different. Substitution with exhausted drug. In this type, the same drug mixture is admixed but is devoid of any medicinally active constituent. So, phenyl, when it is exhausted, does not contain phencone and anethole as much as the official drug. Coriander does not contain coriandrol because the amount of volatile oil is less in an exhausted coriander, and similarly is the case with caraway or clove, where the volatile oil is lost. So, these are natural characteristics of exhausted drugs like color and taste are manipulated by adding other additives. For example, exhausted gentian is made bitter with aloes. Presence of vegetative matter from the same plant. This is foreign organic matter which is present in an official drug. So, sometimes the other miniature plants growing along with medicinal plants are mixed with the drug due to their resembling color, odor, and in some cases constituents. We recognize a cinchona by presence of mosses and lichens along with the drug. Hence, mixing with these lower plants may be identified as adulterants. This is very much of concern. The harmful adulterants when added to the drug, the level of adulteration in honey is so common that it is very difficult to find a pure honey in the market today, and there are highest chances of adulteration in such kind of drugs. The waste collected from the market is often admixed with this. So, pure honey is known to contain proline, otherwise it is just a sugar solution, and it can be identified by detection of that amino acid proline. So, particularly for liquids or unorganized drugs, it is very easy to add an adulteration. Colophony is a very expensive resin, and it is often found adulterated with glass pieces of amber. So, you can imagine how harmful these adulterants are. This is colophony, which is amber colored and looks like a crystal. So, similar looking substance, pieces of glasses are added to colophony, which not only increases the weight but also the volume, and this is an intentional harmful adulteration. Asafoetida, pure asafoetida is also very expensive, and limestone is often added to asafoetida. Adulteration of powders. Besides the entire drugs, the powder forms are frequently found to be adulterated. Example, dextrin is added to ipecacuanha. Powdered licorice or gentian is often mixed with powdered olive stones. So, here the powdered gentian looks like this is mixed with similar looking powdered, and this is olive stones. So, when you powder this can be easily mixed with similar looking gentian. Red chili powder, this is again very harmful adulteration mixed with synthetic red powder or even to the extent of brick powder. So, besides these common practices, sometimes other methods are employed, like the use of synthetic chemicals to enhance the natural characteristic. Sometimes synthetically manufactured flavors are added to enhance the flavor of an official drug. So, concluding, adulteration is becoming a major concern with respect to herbals, and detecting adulteration in herbal drugs is very essential today to ensure patient safety, therapeutic efficacy and regulatory compliance. Adulterants, whether intentional or accidental, can compromise the pharmacological activity of herbal formulations by introducing toxic substances and eroding the consumer trust. Rigorous detection safeguards the integrity of traditional medicine systems while aligning with modern quality standards. Moreover, it supports sustainable sourcing, protects endangered species and enables global acceptance of herbal products through validated standardized practices. In essence, adulteration detection is not just a quality control measure, it is a cornerstone of ethical, scientific and responsible herbal drug development today. Thank you.